I'm going to share the screen with you. Okay, so our unit is all about children illnesses. So Unit 5, understand how to support children who are unwell. So if we go to question 1, it says identify common childhood illnesses. By the way, I just want to remind you, if you see this star, that means it's only questions and answers. There is no reflective account, okay? So it's all questions and answers. So, and this is for you, Humaira, because this is your first time joining our class. When you open the file, you click here on enable editing, then you can type in, otherwise you wouldn't be able to type, okay? So now, question 1, identify common childhood illnesses. So do we know what's the common childhood illnesses that we have? I'm just going to enlarge the screen so you can see my screen. Can you all see my screen?
Yeah.
Yeah.
Okay, excellent. So can you think about common childhood illnesses? Can you give me examples?
Common cold.
Cold, flu.
Okay, cold, that's very good. Common cold.
Yeah.
Chickenpox, measles.
Yes, very good. So we have chickenpox,
Stomach.
German measles. We have measles.
Okay.
Hand
Ear
and foot and
infections.
mouth incubation.
Yeah. Ear infections.
So say again.
Ear infections.
Air infection, very good.
Influenza.
Usually.
Impetigo balls.
Yeah.
And impetigo non-balls.
Yeah.
Influenza.
Yeah.
Yes.
Scabies.
Yeah.
Scarlet fever.
Diarrhea and vomiting.
Very
Yeah.
good. Diarrhea and vomiting. Common cold.
Yeah.
And whooping
Whooping cough.
cough. Very good.
Meningitis.
Meningitis, very good. And mumps.
Tonsillitis.
Tonsillitis, very good. So all these are our common illnesses for the childhood. So let us talk about, because the question where it says identify common childhood illnesses. So if I count them, just put the names of these illnesses to answer the questions. That's full answer, okay? And also what I can do, not only the names, because I am level 3, like you are level 3 here, not level 2. So what you can do, you can put the illness and put some of its common symptoms. So for example, if you put here chickenpox, you need to say what is chickenpox all about.
Yeah.
Sorry, just 1 second. Let me just put the charger because I can see the screen lighting have gone. Okay, just 1 second. Okay, so for the first illness, which is chickenpox, what's the common symptoms and signs for this illness?
Some
having
spot going to appear on the skin.
Excellent, very good. So we have pink spots that turn into blisters later on, slight fever. Also, the children will feel unwell. They have spots, very itchy spots. Yeah. How about the German measles?
I never heard.
What about the German measles? Any idea? As you can see here, each illness, they tell you how long the incubation time is for. So incubation time is between 2 to 3 weeks for the chickenpox. German measles, it takes 2 to 3 weeks as well. Measles, so the German measles, first of all, it's a slight fever, rash, tiny red or pink spots. Yeah, the rash will start on the face, neck, and then spread out to the body. So how about the measles? So as you can see, the incubation time takes between 10 to 14 days.
There's a cold symptoms and normal measles.
Yeah, so the normal measles, what's the signs, what's the symptoms for the measles? Obviously, the child will feel unwell.
Red eyes.
Yes, very good. Tiny spots on the mouth, on the throat. Sorry, there is noise in the back. Please, if you have this noise, could you please mute yourself? Okay, thank you so much. Yeah, so for the measles, the child will feel unwell. They will have they will have tiny spots in the mouth or the throat, cold, like symptoms like runny nose, red eyes, sneezing, rash. You will see on their faces they have rash. How about the hand, foot, and mouth?
In that, one of the hand and one of the foot is like it will be on pain actually. My child had this one last year.
Okay.
It's a kind of infection with a fever, cough, and like sore throat.
Very good, excellent.
She cannot walk actually with one leg. There's a pain on one foot and one hand. I noticed.
Very good, excellent. And also, the child will lose the appetite. Very good, and that will take 3 to 5 days.
Yeah, the fever and so unwell.
Excellent. How about Impetigo bulls? The incubation time between 4 to 10 days. What do you notice on the kid?
Don't have any idea about it.
You will find the same as well. You will find the blisters, but these blisters will be fluid filled. So you will see there is a fluid in these blisters. Appears on the chest, okay? And also the blisters spread quickly, but it's not painful or itchy. You just find these blisters spread on the chest area, and you don't know what's the reason. Yeah, so that's Impetigo balls. How about Impetigo numballs?
It's all around the nose.
So you will find red, and it is sore around the nose and the mouth.
Yeah.
Sorry, there is some noise still. I can't put my hands on it.
Good morning, Miss.
Hello, good morning. Okay, so yeah, so now how about the eye infection? Can you tell me what's the symptoms for the eye infection?
Eye, ear.
They will have temperature.
Temperature, yeah, higher temperature.
Very good. So
And
the child will feel unwell.
He has a pain in infection in the ears.
Very good. And the toddler might start rubbing them and pulling their ears. Why? Because it hurts them. That's very good. So how about the influenza? Is there any symptoms to the influenza?
Runny nose.
Runny nose. Okay.
Fever, headache,
Fever and headache, very good.
And the
And it's
tidiness.
all a sudden.
they are really tired, and maybe
Very
they
good.
have a cold.
Yes, the child will be tired, feeling chesty, feeling unwell.
Yeah.
And they have a dry chest, cough, tiredness, as your colleague said, aching muscles. They will be feeling really tired, and but their body hurts
Very
them.
muscles, yeah.
Very good. How about the scabies? Do we know anything about scabies?
Yeah, it is a bacterial infection.
Okay. And
It's a rash.
yeah, the child. What's the symptoms of on the child? They will have tiny rash, okay, and very itchy, and also the child might develop blisters on the feet. How about the scarlet fever? Do we know anything about the scarlet fever? Any symptoms?
Yes, the scarlet fever is a kind of rash. It is emergency kind of thing with this scarlet fever for the kids. We need to go for certain tests regarding like if child is unwell with high fever, with the sore throat and the rashes all around the arms, the chest, body, and it comes from the face to the feet.
Very good, excellent. Well done.
Yeah.
How about the diarrhea and vomiting? Do we know anything about the diarrhea and vomiting?
Maybe it's,
Yeah, when they children eat or drink something, they got a vomit.
Yeah,
vomiting.
absolutely. They
They
wouldn't
are
keep
feeling
anything
vomiting,
inside. Yes.
and their food becomes so soft.
And what's the reason? Oh, sorry, there is some noise in the back. Could you please mute yourself if you have this noise? Okay, so what's the reason you think for the diarrhea and vomiting?
Bacteria or some viruses.
Yes, very good. It comes from normally food poisoning.
Food poisoning or E. coli infection.
Excellent, well done.
Yeah, upset stomach.
Okay, very good. So how about common cold? Do we know anything about common cold?
Yes.
runny nose,
Very good. Runny nose.
sneezing.
Temperature.
Sneezing, the temperature
Very good.
changing.
Sneezing. And also the temperature will go higher. Very good. Rise in temperature. How about whooping cough? Do we know anything about whooping cough? What's the symptoms?
Yeah,
As you can see, this illness takes so long, the 6 to 20 days. What's the symptoms?
the cough start mild in the first, but it increases, it's continuous in the long
Very
run.
good.
And it has some incubation period. Within that time, it will get recovery.
Excellent. Very good. Can you think about another symptoms for the whooping cough? The child will feel unwell. They will have temperature.
The temperature.
Any other things?
Yeah, the vomiting will be there. Yeah.
Vomiting after coughing, very good, excellent. And they will feel tired, the tiredness, exhaustion. Because they cough a lot, so they will feel tired.
I just got a question. Is whooping and cough, is that the same? Whooping,
Guys,
cough, and
the noise is very, very high.
I can't hear you.
Could you please mute yourself? Okay, so now, how about the meningitis? Do we know what's the meningitis? Yes? Anyone can participate to tell us what the meningitis, like, what's the symptoms for the meningitis?
You had a meningitis.
Sorry, say again?
The meningitis is always has a starting with a hard headache.
Yes, very good. It
So
could be fatal.
And
It's not like an easy illness.
Yeah, after they getting vomiting because of
Yes.
headache, and they feeling dizziness.
Okay, very good. So the symptoms for this illness: severe headache, fever, cold, hands and feet, and also later the symptoms will get even more. So you will see vomiting, you will see drowsiness, the child will be unusually crying too much, and the breathing will be going faster and faster, and then he will be unable to tolerate any brightness, so he wouldn't be happy with any bright area. So all these are and also red rash, and the color would not fade easily. So this is all the meningitis symptoms. How about mumps?
Mumps.
Yeah. The child will feel headache, joint pain, and fever. Yeah.
Yeah.
And also will be followed by, and then will get more complicated. The swallowing will suffer for the child, and then swallowing from under the ears. And how about, still there is noise in the back, guys. How about tonsillitis? Do we know anything about tonsillitis?
Yes, tonsillitis is the soreness of the throat, and there will be white spots near the tonsillitis. If it has got pus type of spots, means that the kid is with the tonsillitis. He will have high fever, sore throat, muscle ache.
Very good. And also headache. Well done. Excellent. So now we are going to answer this question. Sorry, there are still noise in the back.
Microphone.
Yeah, if you have a noise, please. Okay, thank you so much. So now to answer these questions, I'm going back to my questions, okay? So question 1.1, identify common childhood illnesses. So what I would, if I were going to answer this question, I just put the names of these illnesses which we have just described, yeah? Is it clear?
Yeah.
And then question 1.2, describe symptoms and signs for the common childhood illnesses. We just done it now, so I described all these signs. So I have answered just now question 1 and question 2. Is that clear?
Yes.
Do you want me to repeat it?
No.
No? Excellent. Very good. Well, to be honest, not I have answered, you have answered it yourself. You were very good. You participated, you know the common illnesses, symptoms. Well done. So you basically have just answered the question 1 and question 2 of this unit. So now, if we were to answer question 3, it says explain treatment for common childhood illnesses. So I go to the treatment. So I go down there. As you can see, Humaira, the book is just word for word. You see here, 1.3 treatment of common childhood illnesses. It's not difficult to answer the questions. All you need to read the book, okay?
Okay.
Because this is your first time. I'm just want to go through it. So 1.3, exactly like what you have here, 1.3, explain treatment for common childhood illnesses. All you need to read the book and then answer the question correctly. So how to treat the common childhood illnesses. So let us go on same illnesses. I'm just going to go one by one. Okay, so now chickenpox, how we treat it.
We give
Something.
calamine lotion and
So can you put your head a little bit closer to the computer so we can hear you? Yeah, so how we can treat it?
With some cream.
Yeah, to be honest, for the chickenpox, no specific treatment. They normally give paracetamol to the child just to get rid of the fever, lotion, as your classmate said, and just to get him cooling down. Otherwise, there's nothing we can do about it. How about German measles? What's the treatment?
actually it's contagious. Measles is contagious, so you should be you should keep yourself away. Maybe you can isolate for that kind of measles, and there's no specific treatment. It means only paracetamol can be given until the incubation period is done.
Well done, excellent. And if there is a child with a pregnant woman, we should keep the child away from this pregnant woman. Why? Because it could be harmful for the baby. Very good. How about measles? How we can treat measles?
Same
Again, same thing. Yeah. Anyone can participate, please? Okay, for the measles, same thing. There's we can use paracetamol to reduce the fever, and children may be kept in a dark room. Plenty of drink. We have.
Plenty of drinks.
How about hand, foot, and mouth? What we going to do for the children?
Yeah, there's no specific treatment. Actually, it has an incubation period of 3 to 5 days, I remember. And just have plenty of fluids and soft foods.
Well done. Excellent. Perfect. How about the Impetigo balls and numballs? How we treat them? We just give them antibiotic cream and tablets, nothing else, yeah? How about scabies? How are we going to treat scabies?
There's a cream, insecticidal cream.
Yes,
family members will need to be treated.
Yes, excellent, very good, well done. How about scarlet fever?
The scarlet fever is treated with antibiotics.
Yes.
Paracetamol to lower the temperature.
Very good, excellent. We need the paracetamol to lower the temperature. Very good. How about meningitis?
Yeah, meningitis is it also requires hospitalization and antibiotics. It is a serious issue.
Very good, well done. And then that's meningitis bacterial, and there is meningitis viral. Meningitis viral, the same thing should be, the child should be hospitalized, yeah, and may need a long treatment, yeah. We need to give them antiviral drugs. How about Mumps?
Mum says when you have got sore and swollen glands, it means that you have to drink liquid, take softer foods. And there's paracetamol if there's a muscle ache and the temperature.
Very good. And what we can give to the child? We will give them just soft food because they can't swallow. So we give them soft food. Excellent, well done. How about the influenza? Do we know anything about the influenza? We all had influenza, not only for the kids. Is there any specific treatment? No specific treatment, correct? Normally we have, even us, not only the children, we have just paracetamol because you feel tired, you feel pain in your body. So we just get paracetamol.
Yes.
And also plenty of drinks, obviously, if for the child. How about diarrhea and vomiting from food poisoning?
Less food. I think with less food, we have to give less food, more drink.
Very good, excellent.
We can just give the child the electrolytes to maintain the electrolyte balance.
Mm-hmm.
We'll get it in over the counter, and we can just give some soft foods, plenty of fluids, because
Yes.
yeah,
But the fluid shouldn't be fizzy.
yeah,
It should just be water or any other juices. How about the food? Can be introduced when the vomiting has stopped, because the kid, when they have food poisoning, they vomit a lot. So until they stop vomiting, then we start giving them small portions of food. And needs to be high carbohydrate, such as pasta, bread, rice. This is recommended. And any other things you can think of? How about the medical attention? Do you think this child they might need to be taken to the hospital, or bring a doctor, or call the ambulance? We might do that. Why? If the diarrhea doesn't stop or doesn't improve after 7 days. If there is a blood, as well as that, if the vomiting was without diarrhea, then there is something wrong. He's just vomiting non-stop. Maybe there is something else, so we have to call the ambulance.
yes.
Okay. How about the ear infection? Sorry, there is still noise in the back. I would like to noise in the back.
Make microphone.
How about the ear infection?
They have got wax in the ears sometimes, so we need to dewax it, or we can just put some olive oil drops to dewax the ears, and maybe they'll have some sound, some noises in the ears as well with this infection.
Yeah, well, normally we just give them antibiotics, yeah? Not much we can do about ear infection, just antibiotics. How about the whooping cough? The whooping cough. We are as well, we give antibiotics as soon as possible. And if they were under 12 months, could be dangerous, so we have to take them to the hospital, okay? If they cough a lot. How about tonsillitis?
Like
Again, sorry.
The paracetamol to lower the temperature, and the antibiotic amoxicillin or penicillin in it.
Very good. We give them plenty of drinks and soft food to be offered. Well done. Excellent. So we have just answered question 1.3. Well done. How about 1.4? Identify exclusion period for common childhood illnesses. What does it mean, exclusion? Do we know?
The incubation period?
Yes? What is it?
The incubation period.
Very good. There's no, the exclusion, not the incubation period. So for the exclusion period, from the word itself, it means exclusion, excluded. So we don't allow them to spread the infection. We stop them from going to the nursery, just maybe sit at home, or because we don't want all the kids to have same illness. Okay, so to prevent the spread of infection, all early setting and schools will have a policy that the children, if they are ill, shouldn't be returning to the school. They give them certain times for each illnesses, and these times are here. For the chickenpox, how long they need to sit at home?
5 days.
Very good.
5 days.
The onset of the rash.
Yeah, so as soon as they get the rash, we count 5 days and then they can go back to the school. How about German measles?
6 days.
6 days.
Very good, 6 days. Hands, food and mouth? None. There is no exclusion period, so they can just carry on going to the nursery.
Okay.
How about Impetigo?
After starting the antibiotic course, maybe they can join the nursery.
Very good. So we wait 48 hours after they take their antibiotic treatment. How about the influenza?
Until recovered.
And they are recovered.
Yeah, exactly, because it could be a long time, could take very short time. It depends on the body and how they fight the influenza, the children. So it could take until the child recover. How about measles?
4 days.
4 days, very good. How about scabies? Scabies, none.
Not
Yeah.
necessary.
How about the scarlet fever?
24 hours after commencing.
Very good. They just need to go and rest for 1 day and then come back. After the antibiotic treatment. How about the diarrhea and vomiting?
48 hours.
From the first time they had the diarrhea and vomiting. Very good. How about the common cold?
It's not necessary.
Yeah, common cold. Like you can't say to the parents not to bring their child just because of common cold. That's just normal. Yeah. How about whooping cough?
5 days from start of antibiotic treatment.
Very good.
Okay.
21 days. Yeah.
Yeah.
If we don't use antibiotics with them, some parents, they don't prefer to use antibiotics for some reason. Maybe the child can't take it, or the parents do not believe in the antibiotics, so then they have to wait for 21 days. How about meningitis? Bacterial.
And they are fully recovered.
Until they are fully recovered. Very good. And then meningitis viral? None. They can just carry on. How about we have 5 days, and tonsillitis, there is none. Yes? So this is to answer question 1.4.
Okay.
How about 2.1? Describe signs and symptoms of ill health in children. So how do you know this child is ill? So I'm going to question 2.1. Let us go.
Fever.
How would you know that this child is ill?
They got fever.
Fever, cough, running nose.
Yes, exactly.
Or
There are some
feeling really
certain.
The baby's feeling viperings more than usual.
Getting well.
Exactly. So they will feel unwell. You can see these symptoms. They have either fever, the diarrhea, they have some kind of symptoms. You can see
And they
it
are
on
crying a lot.
Very
The
good.
baby.
So to answer this question, it says signs that child might be unwell. First of all, you have dark shadows under eyes. Okay.
Under the eyes.
Paleness of the skin. Okay, and then irritability. Sorry, there are noise in the back. Can you please stop this? Who got this problem? Okay, so if we have a look, the child might have a dark shadow under the eyes. Also, paleness in the skin, irritability, so they get irritable and get angry fast and not happy, and also like becoming clingy and just like always try to be close to the parents, poor appetite, any other symptoms you can see on the child. Also, they wet their bed. They feel tired, and they might have difficulty in breathing. They might show you difficult behavior. They become suddenly like irritable and very aggressive, and they don't want to talk that much. Also, their behavior changes. Okay.
Okay.
They maybe start sucking their thumb for no reason. They need more attention from the parents. You see them quiet. Their color changes. All these are signs that the child is unwell. Is this clear? Yes?
Yes.
Excellent. Thank you. So now give examples. That's question 2.2. Give examples when medical intervention is necessary. So when are you going to call the doctor or maybe call the ambulance? So let us go to 2.2. When do you think it's important to call the ambulance or the doctor?
It's a really high temperature, like above 38.
Yes, very good. So the temperature will go higher for the child. And it's like 38 degrees. If the child is under 3 months, that is very dangerous. So we have to go and call the ambulance to check. Also, if the temperature above, sorry, yeah, you can participate if you like. That would be great.
I couldn't tell in English, but it's common. It was a common sickness from for the early years, like babies. They are dying because of high fever.
Okay. Yes.
I don't know the English name.
It's really hard, like very dangerous for the kids. Very good.
Yeah. Let me check. I'm going to.
Yeah, so if we have the temperature rise above 39 degrees, if the child is 3 to 6 months, so we have to call the ambulance. Also, high temperature with the quietness. You see the child is not responding to you, not talking, not active and happy like usual. He's very quiet, doesn't want to participate in any activities.
And also, if we notice any bleeding or blood in when they vomit.
Very good, excellent. If they have vomit, where is the? Yes, if we have vomiting, we can, and we see bleeding in the vomiting, and doesn't stop for a while, then we have to seek medical attention. Also, the breathing. If there is a sudden difficulty in breathing, they either have faster breathing or very congested chest, then we have to call the ambulance or ask for medical attention. How about the skin color? Their skin color will be different. Yes?
They can change like a yellow when they have a problem with how can I say it?
Yeah, it looks very
like
pale.
a hepatitis.
Very good. Their skin go yellow and pale. Very good. Or it could go red. They have rash. They have, or turning into blue. That's even more scary. Maybe they have something in their breathing. The blood is not circulating very well. That's what they are blue. And maybe whenever the skin change color and change it rapidly, like it goes suddenly red or suddenly blue or yellow, then this is very dangerous. We need to ask what is the reason why that is happening. How about responsiveness? You see the child very quiet, doesn't respond, doesn't like to take part in the activities, just sitting somewhere.
I would like to just sleeping.
Yes, very good. He's floppiness, and he always just want very hard to wake up. He just want to sleep and sleep for longer, and difficult to stay awake. He just
Fast
always
heart
difficult
beat.
for him to stay. And it's all of a sudden. Yes. Also, another symptoms. Can you think about another symptoms where you need to call the ambulance and check or ask for medical attention?
When we see the heartbeat is going very fast.
Okay. Also,
fast heartbeat.
Convulsions.
Yeah, high crying. Also continuous crying, so the child would not stop crying, just crying non-stop. And also the neck. Yes, and also the neck is very stiff.
Yeah.
They don't want to drink anymore. For more than 8 hours, he is not drinking at all, or she is not drinking. You think that can't be like normal. So you need medical attention. Or as your colleague said, repeated vomiting. That's not good either.
Yeah.
Or his vomit is, or her vomit is green. Suddenly change color. The babies also could be, they have, there is still noise in the back, I'm telling you. Okay. Okay, so all these are symptoms for the child illnesses, and we need to get any medical attention whenever we have any of these illnesses, okay? So here, this is the answer for question number 2.2. How about 3.1? Identify notifiable diseases. So here, what we have in the book, we have a big list of notifiable diseases. What does it mean, notifiable diseases? So what does it mean, notifiable diseases, can you think about the word notify, notifiable?
What is
can you think?
dangerous? The dangerous sicknesses like a meningitis, diarrhea, like a rotavirus made it.
Yeah. Yeah, so for these notifiable diseases, we have to notify doctors, yes? For about these diseases, we have to report them by law. We can't just pass it. We have to report it to the local authority that today we had
Usually the doctor,
child.
the GP reported.
Say again?
Usually in Hungary, the GP reported the sickness, the dangerous sickness of the children.
Yeah, absolutely. They are dangerous, so we have to report them. So they either we report them to the local authority or their local health protection team. Okay, and these diseases are spreadable, so that's why by law we have to record them to prevent. Okay, to prevent the spreading of these diseases. So we either prevent this disease or prevent spreading these diseases. We need more information. So here you have a massive list of all the illnesses for the babies. Some of them we talked about, like mumps and measles, meningitis, and some of them are not on the list. So can you please mute yourself if you have this app? Only when you need to talk, you can put yourself on. Okay, so we have a long list of the illnesses. We have some of them we're talking about, like Scarlet Fever, Meningitis, measles, malaria. Like we have so many illnesses. So to answer this question, you can write all these illnesses. But for me, I would like you to go at home and check these illnesses. Sorry, there is a very loud voice. Okay, so for me, to answer this question, I identify notifiable diseases. As we said, you have very long list of diseases. You can write them down. And also for me, to answer the question, you just need to write them down. But for me, if I were you, I would just go and just put each name in Google and just try to get more information or pictures so I can see how it looks like. Like we talked about so many of these illnesses, but it's good to have a picture of each illness. So if you can put it on Google, you will understand how it looks like, just in case you will need to report it. Okay, so to answer the question, you have here all the illnesses that you might have, and they are all notifiable. And you can go to Google and get pictures of each one of these illnesses and find out how it looks like. Because, for example, like we talked about mumps, but you still need to see how it looks like. So if you put the name in Google, you will get pictures about each one of these illnesses that will give you more ideas about it. Okay, now describe the process for reporting notifiable illnesses. So all these notifiable illnesses, you need to report them to the, as we said, to the local authority. So what's the process? So here, 3.2. describe the process of reporting notifiable diseases. So what's the process? Can you think about process for that? So when the child is really ill, the family will take the the child to the GP. Then the GP will fill out form and will send it to the local authority protection team for early year setting. Okay, and if the child has serious illness, the earlier year setting must be within 14 days. So that's very, very important. So if the child has the early year setting is called this is usually very suitable for the setting. And also they need to discuss the local authority. Yes. And this is done by calling the health protection team directly. So the manager will call the protection team in the local authority and report that. Is this understood? So when you answer this question where it says describe the process for reporting notifiable diseases. So to answer this, you say when the child is ill with notifiable diseases, the family GP, because the family will take him to the GP, so the GP will fill a form, send it to the local authority protection team. And also for the setting, when they found out that the child is ill with the notifiable illness, they must by law report the office within 14 days. And this is normally the responsibility of the manager of the center or the deputy manager. So they have to inform the local authority protection team. How they do that, they call the protection team and inform them directly. Now question 4.1, explain how early years practitioner can minimize ill health in children. So for you as a practitioner, how would you minimize the child illness in your nursery?
Keep hygiene.
Very good, very good. I keep hygiene. Can you please talk a little bit louder because we can't really hear you, but I heard you saying hygiene. Yeah. Very good. So we need to keep the nursery always hygienic. We need to stop spreading any infection. We always use gloves, apron. When dealing with body fluid, make sure that the adult always washing their hand. We teach the children to wash their hands as well. And after we touch, yes, exactly. After we touch the ill child, we always have to who looks clearly, fully. So then we have to wash our hands, or even when we give them medicine. Also, how we prevent the infection. If the children are ill.
If we notice a child different behavior or unusual behavior, we have to contact the parent and explain to them. So in case they won't self-isolate like chickenpox.
Yes. So if sometimes there is a secondary infection, what's that secondary infection? If the child is ill because they are weak, so what happened? They will pick up another infection because of their immune system is really weak and the body can't fight these germs. So to prevent it, what we can do,
Vaccination.
Yes.
The job, vaccination.
Yes. Vaccination.
Or advise parent to keep their child staying home.
Okay.
They are
Good. Very good. If the child is ill, we can ask the parents to keep the children at home. Otherwise, they might pick up another viruses in the way because they're weak. Because of their weak body. Also, how about the hygiene?
Yeah, always washing hands.
Very good. It's very important.
Yeah, with the right procedures and process of washing. It's not just washing with water.
Very good. Excellent. And also not only the people who works with children, the visitors as well. If the visitor stays there for a while, we ask them to wash their hands. The environment should be always clean, always hygienic.
Yeah. And when coughing, just cover mouth.
Yes, very good, excellent.
Ventilation, the room.
Yes, good ventilation to the room. Also the bed linen, we should always change it every few days. So the children's pajamas should be always changed, the underwear.
Yeah.
The room itself should be kept, as you said, ventilated, hygienic, clean, always. That's to reduce infection.
Yeah.
Also, how we can deal with the secondary infection. Also, mobility. This is how we fight secondary infection. So if we see the child is a little bit poorly, sitting somewhere quiet, we can do mobility. What that mean? The child will benefit from moving a little bit. So if the child moving for a few minutes, they will feel a little bit better. Okay, so we don't let them just sleep and forget about them. We need them to move because that will encourage their body to fight the infection. And why? Because it encourages good circulation to the blood. Yeah. And also, as your colleague said, we need good ventilation, opening windows. This is we will get rid of the viruses and the bacteria in the air. Why? Because the fresh air will come in and the bad air will go out. The hot air always move up and go out of the room. So we need to have good ventilation. Any other things we can do? Also, we encourage the children to rest, to have a little bit of sleep. Yes, we said we don't want to encourage them to move for their good circulation to continue, but also we encourage them to sleep. So also encourage them to have a nap if they feel unwell. Why? Because this will make them feel better.
And eating well.
Yes,
eating
very
healthy.
good. Give them some activities if physical, not demanding physical energy, like just jigsaw or some play cards or some reading books. Any activities might get them going, but not too much. So they need to rest, but in the meantime, we encourage them to do some movement to encourage their circulation. Very good. Any other things we might do?
Diet.
Yes, excellent. We need a good quality diet. So the children are
Good morning, Lana.
Hello, good morning.
Sorry, I'm late. Yeah, I'm sorry about that.
That's good you are here. Thank you, because as I told you, always is from the noise in the back, please mute yourselves. Okay, so it's good because you're attending. Why? Because the attendance sheet is generated automatically from the meeting site, from Teams. So it's good to attend. Thank you for attending. And also you will learn a lot. So it will be easier for you to do your coursework. So now we said how to fight the secondary infection. Also, you kind of have good quality diet. So what children eat speed up their recovery. So if we give them a food high of protein like meat, eggs, fish, chicken, all this consider very beneficial for their health. Also, we give them fruit, vegetables. Protein is very important to repair the cells, and also fruit and vegetables will give them minerals, vitamins, will help them a lot to recover. How about iron? We might not get iron from food, so what we give them tablets or maybe a drink to make sure they are healthy enough. How about another things we can do to minimize the secondary infection? Minimizing contacting with others. What does it mean?
We have to separate the sickness people, the sickness child.
Distance, social distance.
Very good. We need distance. So if there is any visitors, it is important for these children not to contact with anyone who is poorly themselves. So if the child is ill, we take him a little bit away from other children. Or if any visitors come in, we need to not to make sure they are a bit far away from the children. Yes? This is all to avoid infection. So any child who's ill, we make sure they are a little bit separated from other children to avoid infection. So this is to answer question 4.1. Explain how early years practitioner can minimize ill health in children. So to minimize it, we need to talk about all these points from the beginning, which is 3.2. No, let me check. 4.1. It's here, 4.1. So when I want to minimize infection, first of all, I do the preventing the spread of infection, preventing the secondary infection, and also all these points, which is hygiene, mobility, good ventilation, encouraging children to rest, and providing a good quality diet, and also minimizing the contact with others. And you need to talk about it a little bit thoroughly. It's good to put as much in your answer, as much as information, because just to show that you understand and you understand well. Yes, because it's very important. You're going to be soon working with vulnerable children, so we need to make sure that you know how to do it and how you can take care of them. So now question 5.1, describe the need of a child who is ill in relation to food and drink. So food and drink for the ill child. Let us go here. For 5.1, the need of an ill child. So in terms of food and drink, so what does it mean? Let us describe it anyway. So for the child who's ill, what do you need to do? What's your responsibility as a practitioner?
Provide them a lot of drink, like water.
Very good, excellent, very, very important. Mainly the children will have fever, so having the water is really important for them. Give them lots of water if they are ill. And also,
provide them easy food to eat.
Very good.
So they don't need to spend lots of energy. Yeah.
Excellent. We need to provide them with easy food to eat and to swallow, such as soup, Yes, so it is important. Also, we need to maintain a routine. So when the child is ill, the routine is helpful for them, to give them security. They know that there is, for example, there is a breakfast at this time, lunch and dinner. We have to keep it going. Even we give them small food, as your colleague said, like small portions of food and maybe soft food. But we keep the routine so they don't feel scared or worried that they are ill. How about the food? We give them soft food.
Soft.
Yes, easy to swallow. If they feel unwell, like mashed potatoes, yogurt, soup, easy for them to digest. And especially if they have sore throat, or they feel they have bad stomach, we shouldn't give them hard food. Also encourage the child to eat, because it benefits them. When they eat, they recover faster. Even if it is a small quantity, it's better than nothing. Okay, so that's for food. How about drink? Because it says food and drink. How about the drink?
Water, especially need water.
Very
Not
good,
like
because they get dehydrated.
Yeah.
So we have to prevent that by giving them water. Any other things you can think of?
Maybe tea.
Yeah, well, not tea, milk. Yeah, so we give them water, we give them milk, we give them juice.
Fresh juice, yeah.
Yeah, but when they are vomiting, the milk made them hard swallowing. So we have to avoid the milk production when children has diarrhea and vomiting.
Yeah, so
Drink lots of
if we
fluid.
have diarrhea, the best option is the water. Although we can usually give them milk, but for the diarrhea, the water is the best option. Also for the fever. Very good.
Drink a lot of fluid.
Yes, very good. We make them drink a lot of liquid, like as we said, juice, milk, water. Very good. So this is to answer this one. How about personal care? Second one, personal care. What does it mean to the ill child? Personal care.
We have to pay attention and take care more than usual.
Keep them always clean. So
clean, yeah.
Yes, very good. So if it is important for the child to keep it clean when they are ill, to monitor their personal care routine, okay? This is to prevent any risk of skin infection. So we need to make sure of the hygiene, but not also to make sure we are preventing risk for skin infection, but also to keep them feeling comfortable, make them fresh. Okay, so many children may also need they might have toileting accident, may need more attention from us. Yes, and because they are unwell, they might not be controlling their body well, and they might be feeling sensitive about this. So we need to act as if it's a routine. It's nothing happened. We just wipe it off. Yes, and we need to dispose these tissues properly. Why? To prevent infection, because this could be infectious. So we get rid of these tissues properly, and also we wash our hands and the child's hands. That's good. Now, what about the rest and sleep? What is it all about it? What are we going to do for the rest and sleep?
We have to ensure that children has enough time to sleep and rest.
Very good. To avoid
soon.
Very good. To fight the infection, we make sure to give the child enough sleep.
Yeah, because when children are ill, they are likely to want to sleep and rest more. Yeah, better
Excellent.
than.
Very good.
Yeah.
Because the child, if they are ill, they want more sleeping. They need to go to bed longer. So it is important to follow the child's need for sleep and rest and give them more time, more than the usual routine. Bedtime.
But just keep our eye if the child exaggerates for sleeping longer than usually. Is not good for him.
Excellent, very good.
Mobility.
And yes, and if they feel better,
they can enjoy the others, but
yes,
less
good.
activities. Yeah.
Very good. We need to understand when they really need sleeping and when we can maybe get them involved in certain activities, small activities, to get the circulation going. You look at the child, if his eyes are red and he can't even control his body, his head, and he's really, really tired, then we have to let them sleep. Yes? So it's all about how they feel. They need rest. They need more rest and more sleeping so they can fight the illness. Emotional well-being. So if I go to emotional well-being, if they are ill, what do they feel? They feel they are vulnerable. Don't you think so? Yeah. The child will be very clingy, wants some attention, wants extra cuddles, extra reassurance. Okay, so the child might need extra reassurance. You see them very quiet, very clingy to you, want cuddles, want reassurance, needs hugs. He's very sad. Some children will also want the adult to sit with them while they are falling asleep. Don't push. If there is a noise in the background, you can stop because this is. Yeah, if you can't stop it, you only switch it, like turn back the noise when you want to talk and then put yourself mute again. That would be great. Please, can we do that? Because it's good to have this video clear, so when you go back to your doing your coursework, you can understand it. Otherwise, you will get bored listening to all these noise while you do watching the video. Okay, guys. So yeah, let us go back to the children. So the child need to, as we said, when they are ill, they feel clingy, they need extra cuddles, reassurance. So the adult could sit with them until they fell asleep, and they need this reassurance from the adult. They need that this person is listening to them, sitting next to them. So it is very important to recognize that if there is any coughing, if any vomiting, if any other signs that this child is ill, we need to take care of this child. So the children may need also the adult to acknowledge how they feel. Maybe you can ask the child, are you feeling okay? You can check with him his fever, sit with them, maybe bring them some more soft food or drink to eat. Just make him feel or make her feel that you give them extra care and attention. That is very important for the child because he's emotionally, for his emotional well-being. How about dignity and respect? Do we know anything about dignity and respect? If the child is ill? So while the child is ill, they got the right to dignity and respect. We should be taking care of them. We talk to the child. We listen to the child. We don't ignore them. We carry out physical care routine. We wash their faces if they have fever. We undressing them if they have too much clothes on and they feel like really hot. Maybe give them, maybe take off some of the layers they are wearing. Or maybe put them in their pajama if it is more comfortable to sleep. As part of the child's right to dignity, we should try to give them much privacy as possible. If they go to the toilet, we encourage them to do their own personal care. It's very important. How about observation and monitoring? What about observation and monitoring? Do we know anything about observation and monitoring?
When the children are sick, we have to check all the time them condition, how they changing during the sicknesses.
Very good.
We check
Very
his
good.
breathing,
So
monitoring breathing.
excellent.
Yeah.
Breathing, the fever,
Fever.
check the color of the skin.
Yeah.
Very
Any
good.
blood.
Why? Because the child changes very quickly. Maybe one moment he's fine, maybe another moment
But
he's not
another,
fine, and
yeah,
he increasingly
getting
getting
worse.
more ill as the day progresses. So what we need to do, we need to monitor them, monitor the progress of their illness. Do we need to call the doctor? Do we need to speak to their families? Do we need to watch them if they are ill? We don't ignore them, yes? And children should be therefore always observed, monitored, and even when they are asleep, we need to monitor them. Come from time to time, have a look. Are they well? Are they okay? It's very important. If you are sharing the care of the child with a parent or another professional, it is very important to keep record of this. So if they have illness, you need to keep records of their illnesses. What happened? The temperature, did it go up? Did it go lower? How much fluid they have during the day? When did he start or she started to feel ill during the day? All this is very important to record. Okay, so all this observation and monitoring. So here, if you can have a look as well, we monitor the children temperature, fluid intake, skin color, and also responsiveness, changes in their illnesses like coughing, sudden vomiting, passing of urine is very important, and also records keeping. So for us, we need to keep records about these illnesses, what the progress and what did we do for the child until this moment. All this need to be recorded. So now, if we answer this question, 5.2, outline the process of storage of medication. So do we know anything about the storage of medication?
To make
There is
sure
a second. Yeah, sorry.
Medication should be
so
stored
that
in the
away from the kids.
Very
And also
good.
to label all the medicine.
Well done.
Yes.
So
first aid
to
box.
Yes.
Yeah, first aid box should be available anytime. It's not just when we see the child unwell, we just wasting time when we go to look where is the medication.
Very good. So according to the EYEs, there is a legal requirement. We should keep these medication in a locked-in cupboards with a key, and they should be clearly labeled. This is like required by law. So if it was a long-term medication, such as asthma, we only need these children to feel to use them at all times. So we need to have them in a specific place. So it is very easy to be accessed when there is any asthma attack. We can just have them fast. If it is regular medication, what we can do if there is regular medication, we need to make sure that these medications are suitable for the child, suitable for his situation. Yes, so is this medication are suitable for this child? We need to make sure. And does he has any other medical condition which prevent him from having these medications? Also, some of them are regular use, like injection for the insulin for the child who has diabetes. How about temporary use? Some of the medication we might use it temporarily, like antibiotics. If this antibiotics has been prescribed for the child by the doctor, then we have to make sure, such as eye drop or short-term illness, something for the fever, we need to make sure that we give these medicines on time. What is the procedure for storage of medication? This is the answer for the question. It says, what's the procedure for storing medication? So what's the procedure, how we keep these? All setting would have procedure in a place to store medication. Okay, and it is required by law. So what we have to do for this medication?
We keep them in a locked drawer. Keep it away from kids.
Very good. We need a cupboard specific for the medication. We label it properly and we keep it locked so that the children would not have access to these medication. So how about the inhalers, the things which we need regularly, like for asthma? What are we gonna do with them? We need to put them in a different place where the adults will have a quick access to them. I can grab it fast and give it to the child because they need it urgently. Yeah, so I can't just keep it in the same place. I need it for somewhere where I can access it quicker. Especially if it is lifesaver, like inhalers for someone who's got asthma, is really important. And also we should keep them away from the reach of the children. Some medication might need refrigeration, so I might need to keep it in the refrigerator, in the fridge. And also the setting might have to ensure that the children at all times have no access to any of these medication. Why we can put and install a safety gate in the kitchen, so the children will not be able to get into the kitchen. Everything is locked in. Yes.
Yes.
Lana, what
Okay,
about the rest of medication when we finish treatment of child? Shall we give back to the parent or get rid of them?
Yeah, normally, like the doctor will be having, for example, 1 to 7 days. They will tell you give the child this medication from this time to this time, and then when it is done and finished and the child is feeling well, you just get rid of this because you can't keep these medication. Every child, when they go to the doctor, the doctor will give them specific medication for their own case. Once it's done with it, you need to get rid of it as soon as possible, dispose it properly. Yeah?
Okay, thank you.
Otherwise, there's no point keeping this medication. How you would know who to give it to? Because you need a prescription from the doctor or from the GP. Absolutely. So now, administration. Administration of the medication. So how are you going to keep these medications? So let us go to look for the administration. The procedure of the administration of medication. What is the procedure?
Of medication. The storage of medication.
Yeah, so what we do? Obviously, we need to keep them stored in a cupboard. We lock them by key. That's according to EYE's regulation. What else?
We have to follow the rules what the doctors or nursery are said to us, our recommendation.
Very good. So we also need to follow the GP prescription. The times that even the nurse or anyone who give this type of medication to or maybe dentist or pharmacist, we need to follow to the timing that we give to the child. For each of these medication should be given on time. Also, they will have a written permission in a place, like how many times to be given to the child. So you need to make sure of following this to the exact. You also must have training to give these medication. Not anyone can give medication, even though the description on how many times the child will have is there. But once you start working in a nursery, they will ask you, have you worked with medication before? We need to give you training. They give you training, and always it's good to have them. Yeah. So how you deal with the injections if the child has got to say he needs insulin injection for his diabetes, then you have to give the child this injection. So you need a training. In addition, some of the setting will insist that medication come in their original packaging or container. There is no medication without container. It depends on the policy and procedure for the nursery. Yeah. And why? Because the nursery needs to find out more about this medication. They need to check the outside packet and read a little bit more about it, understand it more, because each medication is different.
Side effects.
Exactly, what's the side effect, everything. That's perfect, really good. So all your setting should have policies about medication and how to do administration to these medication. And it is normally the responsibilities of the first aid person to do the administration for the medication. Okay, so there are normally one person or two people in the nursery who are trained as first aiders, and they will be doing the administration of the medication. It's very important. Okay, so practical procedures to follow when you do the administering of the medication. So what would you do? First of all, you need to read the label. So this is good to when you answer this question where it says administration of the medication, it's good to talk about what is administration of the medication and what's the process. So first of all, The process you follow. First of all, I read the label of the medication carefully. And also the name of the child should be on the medicine. It's very important because you might mix. Like if there are two children have got same medication, you need to make sure that you give the child from its medicine. So you need the name of the child on the medicine as well.
Picture. Sometimes.
Yes, and also the diagnosis that it was given to you by the parents is very important. The expiry date of the medication should be always checked, and instruction about how to take it, was the side effect, all these information you need to have a look at it. How many times in the day the child should take it? Is it before food? Is it after food? Do you need to shake it? You don't need to shake it. You need to know lots more information about the medication. And also for the liquid medication, it's always important to measure it. Like you don't know if you need to give him a spoon, full spoon or half a spoon, or maybe a cup of the medicine. Like the lid of the medicine, you fill it with the medication. You need to check exactly what's the measurements. They normally give you a plastic spoon with a, but you need to know how many. Do you need to give him one? Do you need to give him two at a time? You need to know all this. And also pure the meditation with label away. So you need to check it away if there which could make it difficult to read the label. So if any medicine were pure on the tin itself, that will make it very hard for you to read the label. So you need to make sure you check this carefully. And then obviously, as we said, after the child is feeling really well and better, then you need to get rid of this medication. How about keep a record of the with regard to the medication? So keep a record. There is a procedure to keep record of these medication. EYEs are always have certain procedures to follow. Require the parents to are informed at the end of the session or the day about did the child has got the medication, did he or she not taking it that day. So you need to inform the parents.
We give the children.
Very good. And how about keep a record of the medication? Can you think about what you going to record about this medication? Can you think? What can you record?
The quantity and the reason as well.
Time.
Yes.
How many times or at what time?
Very good. That's very, very important. So how many times the child should be given this medication? Any other things you need to check?
Any effect?
Yes, side effects.
Side effects, reaction of the child to the medication.
Very good. The side effect. The name of the child is very important. Should be on the
medication is important too.
Exactly, and also the name of the medication.
The quantity of medication that was
very
given.
Good. That's very important. The reason why we're given this medication is very important as well.
And the name the person who gives the medication.
Very good. That's very important. So not two people given on the same time the child the same medicine, because that's very dangerous. So we need name and signature of the person who given the medication, and also the reason why we're given this medication. You need to know, otherwise there is no point giving it to the child. Very good. Excellent. Now explain the procedure which are followed when the child is taken ill or in a setting. So what's the procedure you might follow? If the child is taken ill to the hospital, what would you do?
Inform the parents.
Very good.
Yeah.
Inform the parents. And for the child, what would you do?
Just go with him.
Move.
One of the
No.
first aider.
Very good. Reassure the child. But also, you need to
Separate
take him
the child.
away from the other
Yes.
children to prevent
Yes.
infection.
Separate him away.
Yes. Child condition is assessed. Continue to be monitored.
Yeah.
Yeah, so if he's seriously ill, what we do, we need to reassure the child that it's okay to be ill, don't worry, don't be scared. And we need to move him away from the other children to prevent spreading of the infection. Also, the child condition is assessed. Sorry, just 1 second. The child condition needs to be reassessed and continue monitoring them. Parents are called so they can make an arrangement to collect the child where parents cannot be contacted. The earlier setting will call any other
Emergency
person,
number.
like next in kin.
Yeah.
Maybe the mother
Emergency
can't come.
number.
Yes, exactly. She will give an emergency number, or next in kin, maybe she will give her parents' number, or then I can contact this person and let them know if I can't contact the parents. Any other things you can do? If you think that the child condition is deteriorating, what would you do? Is going from bad to worse, what would you do?
Call the ambulance.
Very good. You immediately get the medical attention, ambulance, a doctor, a nurse, anyone you can find around. Very good, excellent.
And
So
let the
that's the
Ofsted,
procedure.
the Ofsted know within 14
Yes.
days.
Very good. Within 14 days, we just studied that. Well done to you. I just forgot that now. Within the first 14 days, the office did need to be notified if it is notifiable illnesses. Well done. Very good. How about this question? Describe how the early years practitioner support a child to prepare for staying in hospital. How would you support the child to stay in hospital? Obviously, you know that going to hospital is very frightening for any child.
Yeah.
Most of the hospitals, they can work with the parents to prepare this child for the hospital. Maybe they can allow the mother to come and do some certain activities. Well, normally the mother will be staying with the child anyway, but they will work with the child, maybe give him some toys, just to prepare him, make him feel comfortable and happy in the hospital. So many hospitals use booklets, films, clip to help the children understand what's happening in the hospital when they are in the hospital. Some hospital will also let the children look around beforehand, so they can go with their mother, just walk around, have a look at the hospital, just to make them feel comfortable that this is just another place to be in. It's not scary. And also, when it comes to your role, what would you do? What's your main duty? Is to work closely with the parents where it is appropriate. So if the hospital would decide that the best to prepare the child is for you to be there. It is important. Why? Because so you need to prepare the child before the hospital. Maybe the child will have operation, not an illness, because the illness is going to happen sudden, and then the child illness might get deteriorate. Then they go to the hospital, but sometimes they have an operation. Or maybe sometimes the illness will take a lot longer to develop. Then you need to prepare the child. This is your responsibility. So it is important to prepare the child. Why? Because if all adults do not work closely, like you don't work with the parents wouldn't work with the hospital, the child will get mixed messages. Everyone will tell the child something else about what's happening, and that will make him more scared about going to the hospital, make him anxious. So we need all to have same idea what we're going to tell the kid. You speak to their parents, the parents will speak to the hospital. We all have same idea what we're going to tell the child, so make him more comfortable. Okay. So describe how early as a practitioner support child preparing to stay in the hospital. So now we've spoken about how we prepare him to get into the hospital. Now, if we want to prepare him to do the admission, go into the hospital now. There are many stages involved in preparing the child for the hospital. It is important to remember that the child needs to understand what's happening. We can't just take them, put them in the hospital. We need to let them know, give them more information. Okay, so the child need to know what's the time of the admission. When are we going to take the child to the hospital? Whenever we have the date, we need to we need to make sure to prepare him for that. So first of all, we need the timing. Also, we need the age of the child if they understand the situation. We need to check if they understand this whole preparation or not. So how adults prepare the child, it depends on their age. Some of them might understand very little, so we give them very small information. Some of them are like 5 years old, they understand a lot. They need to find it harder to understand why the concept of going to the hospital. So you need to give them a lot more information, maybe give them a clip to make them understand. So they need a longer process, more information, repeat them more often, repeat activities, stories until they understand. Also, previous experience of being in a hospital, that could affect the child being taken to the hospital. So how that happens? What do you think? Why previous experience is important?
And the children could be feeling anxious and depressions because they can be with their friends or their parents. And that's why we have to provide them so many hug, love, like a positive energy. We have to give them.
Okay, very good. That's in the normal cases. How about if they've been to the hospital before? If they've been to the hospital before, they would know a lot about it. It's not a scary place. They will go there, they will have some medication and go. So if they've been in the hospital before, they will make them more relaxed.
Yeah,
so
they
you
will
need
be
less
familiar.
preparation. Say again?
So, they will be familiar with the doctors or
Absolutely,
with the
they
hospital.
will
Yeah,
be familiar.
they will
with
adapt.
Excellent. So they will need less preparation. They have a positive feeling about it. It's fine. Going to the hospital wouldn't take long, maybe 1-2 days. They will feel better and they will come off the hospital. So that will need less preparation? How about the level of anxiety of parents? It's very important. Why? Because anxious parents will make the children anxious. So all children quickly pick up on the level of anxiety of the parents. So the adult need to be relaxed around their ill children. They don't need to show anxiety, otherwise the child will pick up and become more anxious, will be fearful and be scared to go to the hospital. Very good. So how we can prepare the child for admission? Here are some ideas which we can add to our preparing to stay in the hospital. Like we can give the children stories, books involving hospitals. So these, so the children can be introduced to the work of the hospitals or the concept of being in a hospital by using lots of books, stories about the hospital and how people can go and become better. So make them feel relaxed about it. They can read to children ahead if they like. So if you're planning for them to go to admission to the hospital, then you read lots of books and stories for them, make them more relaxed, more happy about it, positive. And they should spend some time exploring as well the characteristic of the stories, how they feel. So you tell them that this person was will go away and then he will feel better. That's why he was really happy going to the hospital. So exploring these emotional aspects of this person in the story going to the hospital will help him a lot, will help them. Also visiting the hospital, so where appropriate, maybe this child could go to visit the hospital before they go to the hospital, before they have their operation. Or so what happened there, they will find it useful. Why? Because hospitals are not a scary place, so they can have a look. Everyone's very friendly, smiley, happy, so it's a good place to go to. Also, you can give them films, clips, images about the hospital. This can be very helpful to show a realistic image of the hospital and how this team who work there are very friendly and very supportive. Also the role play. So role play can be very useful in a way that children can understand what's happening. Do we know what's role play? Role play is like one group of people start acting. Yeah, so maybe you can make the children play, one of them a doctor, one of them a nurse, and they will be all talking about what the doctor can do, what the nurse can do in the hospital. Or maybe the adult can be like the practitioner. You as a practitioner can be the person who's the doctor in this play, and then you can tell them that I do very good. I'm very I can help all the children. You just tell them what the doctor would do and make them feel comfortable. Also about creating a scrapbook. What does it mean? It can be worth creating scrapbook, telling stories about the admission into the hospital and ideas, what help the children. Every child can think about ideas and you put it in these about their operation. How many child had operation in the nursery? Then you can ask them to provide ideas, what they did in the hospital, how good was it? And they can write about their own story, yeah? Okay, so that's 6.1. Now 7.1, describe the therapeutic, So was the therapeutic role of play in hospital in supporting children recovery? So like when they do role playing, it's like a therapy for them. Yeah. So what's the importance? What's the therapeutic importance of the role playing for the children? Like when they play doctor and nurses, what's the importance of this when they do the play in the classroom?
To support children recovery as soon as possible. As soon as possible.
Yeah, it definitely will help them a lot. So let us go to where is it? Is it 7.1? 7.1. So let me just go to here. Sorry, just 1 second. Let me, because we need to answer all the questions. So 7.1. That's 6.1. That's 7. Okay, 7.1. So the role playing is very important for the children, for their development, for their learning. So when they are in the hospital, playing is also used to help them to recover. So we can play is very important. Playing, so will help them to enrich their experience, and also they will understand a lot more about the hospital when they are inside. So playing there is very important to relax them, to make them less anxious. It helps them to express their emotions. Yes, it also used to help them gain skills, also develop their any needs they have. It will be developed. The play also will help the children a lot to understand the environment, feeling if they feel unfamiliar or uncomfortable with the hospital. If they start playing there, they will become more comfortable, more familiar. They need to control their feelings. So playing will help them a lot. Take control of all this, and also can make them feel much more confident.
Yeah, and
If
help.
they, yeah.
Sorry, help just to the child express his feeling.
Very good, excellent. Yeah, so the
Role
child,
play is,
while playing, they will express their feeling.
there were when the helped him to develop the communication as well.
Very
and then
good.
the social. So when the child communicate, role play with the parents, with other peoples, he will develop the communication and then develop the social relationships between others. If the child, there is no communication between others, there is no social relationships.
Excellent. That is really, really good. So when you do the playing, the child will feel confident, will feel more in control, will start understanding and making sense of the environment around them, and it will help also the staff to understand the child and the children, how they think, and many of these children will talk while they are playing, so the staff can listen and understand about how these children feels. And so when staff see or hear the children saying something significant or something really important, So if the child starts saying something really important, then the staff can write notes and to issue some so any issues can be addressed. So anything they can hear the child hearing, talking about, it might be very important, so they write it down and address it later on. So any pediatric words, the playing room, there are toys, qualified staff to help the children to play, because it's very, very important. And as children will often be tired or resting, then they can play their own piece or can play with their therapist. The therapist also can help them while they're playing to help the children come to understand the experience. In the hospital, usually there are so many opportunities for these different types of games or role play that they can do with the children to make them understand, to make them make sense of the hospital. Yeah, so some of them, they might show them the medical uniform or talk about the way they work there. So they do role playing. Yeah. If the children are unable to leave their bed, so we can give them toys or activities can be given to them in their beds. Choice of these activities or toys depends on the child age, gender, just to make them more interested in staying in the hospital. Is this clear so far?
Yeah.
Excellent. So now 8.1, describe the responsibilities of early years practitioner when supporting a child who has a chronic health condition in relation to training and development needs. So how would you, and what's your role as a practitioner if the child has got long illness? What would you do?
We have to follow what the doctor recommend for the sickness.
Yes. Very good.
We need some training, and we need some training.
Very good, excellent. So first of all, you need to take extra care of this child, but you don't know how, because his illness is a long illness. It's not short or something will go for after a while. So you need specific training in order to care properly for this child with this chronic medical condition. Then it is important to fully understand their condition, understand their science, what's the significance of the illness, of this science, what's the symptoms, how you can monitor the skin color, how you can monitor their health, is it getting deteriorated or not. Need a specific medication, you need to know which one to give and which time to give. So you need to properly administer the medication, and according to their circumstances. So you need a lot of knowledge and medical preparation. Okay?
Yeah.
So this is your job. So here, example of the chronic health condition. So asthma is one of these diseases, because it doesn't go for it is affecting the lungs, and it doesn't go away. That's long-term illness for the child. Also, eczema is one of them. It affects the skin. Epilepsy. So many illnesses. They're like diabetes are one of them.
Blood pressure.
Yes, exactly. So all these illnesses, this is just example. So what would you do as we discussed here? Where is it? So first of all, you need the training and development. Any other things you think it's your part of duties as a practitioner?
We have to work with the family closely.
Very good. Yeah. Excellent.
Sharing
so
information, yeah.
Very good. So you need to work as a partner in partnership with their families, with the professionals, just to get more information about the illness. It is very important because you work with children. You need to know their medical condition. You need to be very careful when you monitor them. So it's better to work in partnership with the professionals so you can get lots of information, and also with their families. So if it is unfamiliar for you, you need to tell someone. You need to get a training. You need to be honest. Go and inform your manager to prevent any misunderstanding. Just say that you never had any training for this type of illnesses, and you need extra information about how to deal with them. He might or she might help you with this, teach you, give you more training just to deal with this extra
they are
child.
provided.
Yeah, most important thing is to be honest. If you don't know, just say it. Yeah. Also, inclusive practice. It is essential to work in a way that's inclusive. So, if the child has got medical condition, what would you do first of all? Do you know what? What would you do? What's exclusive? What's inclusive practice?
Share activities that we do in nursery, because he's going to miss a lot of things. So we don't want him to get late or behind. We will give the parents ideas and help them to plan activities for this child.
Yeah, so when you say inclusive practice, mean you need to include this child in whatever activities you have. You don't stop this child from taking part in the activities just because he's a chronic disease. So what would you do? First of all, you shouldn't be labeling the child. What does it mean, labeling the child? You say, this child with the asthma, can you take care of him? That's labeling. Is discriminatory. It's not allowed in the child care. And or you say, this diabetic child, can you take care of him? Can you do this to the diabetic child? Can you give him today the insulin injection instead of me? I'm not coming. Or this is labeling. It's not allowed. Also, sensitivity. Children who are have got more medical needs, they are very sensitive. You need to give them extra care, extra attention, extra medical care, and you need take extra attention because of their condition. Also, access. It is important to give the children that could be included in the activities. All these children should be included in the same activities to avoid situation where the child is sitting on their own, not invited, not taking part of these activities. They will feel so rejected by the nursery. They will feel bad. They will have low esteem, self-esteem. So you need to change these activities to suit all the children. For example, create stop and start game. There is if the child has got asthma, maybe there are some dancing activities, some singing activities, maybe you don't do it. Just do activities with the drawing, something he can use his or she can use their hands, or some depends on the child's situation. If they have allergy, maybe don't ask all the children to do activities by picking some food from the plates. Why? Because he might pick something he's allergic to. So we shouldn't. We should monitor these children, give them all certain activities which is suitable for everyone. So this is about training and development we just spoken about, partnership working, inclusion in practice, which is we just spoken about. Now supporting for self. Oh, this is the last one. So what is supporting for self? Let us go for supporting for self. What is supporting for self? We don't know all the chronic diseases. We don't know all the diseases in this world. Is it true? Yeah. So sometimes, even though you studied this course, you go to work in the nursery, sometimes you need extra support. Even though they give you training about illnesses, you need extra support. Yeah.
It's different. Even you know it's different.
Exactly. You might get. You might be stressed because the children are all, some of them sometimes having some different illnesses. This is likely the case if the child has got condition like life limiting. There are so many illnesses, could be life limiting, can affect their lives. So here where we have to, or maybe something like real asthma attack, that's scary for you, not only for the children. Then or child who's got diabetes, losing consciousness, that's really scary for you as a staff. Maybe later on you will get a lot more information, you understand how to deal with it. But here gaining support might mean taking care of yourself. So be sympathetic. If your colleague would need support, you rush, help them. You shouldn't just stop and watch. If you need then support one day, they will come and help you. You can't get support from your colleagues because he's doing feeding or something. You just rush to your manager, gain extra support, talk to the person, to the child family, to the family doctor. You need.
And what's happening when we
support.
don't have manager and the family is not at home?
Absolutely. Especially if it is life-threatening illnesses, you need to make sure you take extra information as you can, extra support, your colleague, your manager, the family doctor. You have all these information in the child in the child file. Then you might need to contact them to get more information. Maybe even your manager wouldn't know that this child could lose conscious that easily, and then suddenly he lost conscious and you don't know how to deal with him because this is a new nursery. The manager has been here for a short time, and then you can go to the child file, get the information, contact the family doctor and get more information about how to deal with that, or maybe call ambulance. So make sure that you manage your own stress. So you shouldn't just take care of everything. If you need support, make sure you ask for support. Yeah? Because sometimes like carers are, child carers are a bit shy when they start working. Sometimes they might not think they need support. No, if you need support, just ask for it. Don't be shy. Because we're all learning. Even the manager, he might not know what's going on. Maybe another colleague who's been here longer, he knows much more about the child. Just ask, get as much information and support as you can. And also in return, if your colleagues would need support, make sure you provide them with the support they need. So, is this all clear? Because we just finished Unit 5. Is this clear?
Yeah.
Guys? I think this unit is much easier to understand than other units, I would say. I find it interesting because this is everyone's life. It's not only
Yeah, this is the life.
Yeah, exactly.